In the FIT heart study, Mosca studied healthy family members of patients hospitalized for an acute cardiovascular event. The family members were randomized into two groups: a special intervention group with personalized follow-up and a control intervention group. After 1 year, LDL cholesterol, the primary endpoint, declined significantly, but without any statistical difference between the two groups. Mosca comments.
We found that many patients, these are family members, remember now in primary prevention, did not know, were not aware that they had elevated cholesterol, high blood pressure. 39% of our patients that had a blood pressure over 140/90 had no idea that they had a history of high blood pressure. So this appears to be a very unique opportunity to identify individuals that are at risk. And we know they're at increased risk because they share genes and they share lifestyle factors with their loved one that's recently been hospitalized. So this is a way we can really extend the reach of cardiology into primary prevention.
Mosca pointed out that only 5% of the FIT trial population could qualify for the Jupiter trial, which showed a dramatic reduction with rosuvastatin of cardiovascular events in patients with low LDL and high CRP.
We need to remember that most people really don't fall into that category, and it's extremely important to capture these individuals before they become high risk and elevate their C-reactive protein. This is really a trial aimed at identifying younger individuals before they develop risk factors and trying to preserve their low-risk state. This is truly the most cost-effective approach.
So what should be done to ensure a low-risk state in this patient population?
We try to help these patients prevent weight gain, which is probably the most important risk factor of all because it causes the high blood pressure, the abnormal cholesterol, and the diabetes. If we could really focus on the calories, eating less, eating a better diet, but also increasing that exercise, then I think we're going to go a long way in primary prevention.
Jean-Pierre Després presented the one-year results of the SYNERGIE study, a lifestyle modification program that aimed to reshape the nutritional and physical activity habits of 150 sedentary men with visceral obesity, high triglycerides, and low HDL cholesterol. They were assigned to a personalized nutritional and physical activity management program that included a monthly visit.
The most important finding in our study, obviously, they reduced their waist circumference by 9 centimeters. The whole cardiometabolic risk profile improved, but was not normalized compared to a group of non-obese control men. So we wondered why. So we found that among those men who remained overweight after 1 year in the lifestyle modification program, but who had normalized their level of visceral fat measured by computed tomography, they had completely normalized their cardiometabolic risk profile. So, which means that the therapeutic objective when you deal with high-risk viscerally obese patients is not to normalize their BMI, but to normalize their visceral fat.
Based on these encouraging results, we asked if such a lifestyle modification program could eventually be implemented in clinical practice.
I think we're getting closer to a support package that we can afford in clinical practice. It costs about $1,000 US per patient per year, which is, pretty close to some pharmacological agent that you would use for the management of diabetes. So we're really close now to something that we could afford in clinical practice.
Those were two very interesting studies. In the context of lifestyle as an intervention for cardiometabolic risk, what are the results from the Jupiter study tell us?
Well, the Jupiter study is in fact a statin study in patients with normal or even low LDL cholesterol, where a statin improves cardiovascular risk and outcome in patients with an elevated CRP. So to me, this clearly indicates that this is a population with a high risk besides normal lipid levels. This high risk is most likely represented by an increased abdominal adiposity because of the inflamed situation. And I think that beyond the effects that you can observe with lipid treatment, with statin treatment, that making these people in addition also physically active could in addition give an enormous benefit to outcome of these patients.
So you reinforce the importance of adopting physical activity combined with a healthful diet as an adjunct or by itself as a treatment strategy for cardiometabolic risk. How do you encourage your patients to do exactly that, increase physical activity combined with a healthful diet?
Before I go to patients, I think we have to bring a message to our colleagues, and I always try to convince my colleagues by saying, if you prescribe a drug, the job is not over, you have to add something more, and this is lifestyle. How do I do that for my patients? Well, I try to learn them what the benefits may be, and then I think you have to give them something in their hands that it makes that very clear to them. For instance, if you show them by the waist measurement what a reduction of a few centimeters may imply, in some people I even perform a CT scan measurement of visceral fat, that I just can show them what the potential benefits of a 5% weight reduction program can give. Secondly, I always give them a pedometer to show them if you move from 7,000 steps a day to 9,000, or if possible 10,000, you should know that, what the benefits may be and how easy it is to perform that. And then finally, I think you have always to negotiate with them, not imposing things, not saying you should do that. You have to give them the possibility to say, I would like to do this and that, making physical exercise a pleasant adventure.
So I think we take away two primary messages. One, the importance of lifestyle, and lifestyle has to be understood as combining physical activity with a healthful diet. And the other is the importance of waist circumference as an outcome, that beyond weight loss, if we use waist circumference as an indicator of the efficacy or benefits of our treatment strategy, it's a win-win scenario. I think those are two positive messages that are important for our listeners to understand.